Many dog owners eventually decide to upgrade their pet's diet, often moving from a standard kibble to a fresh food plan to help improve skin health, boost the immune system, and support better digestion. But you cannot just swap out their bowl overnight. Dropping a new food profile into a dog's stomach is a violent shock to their system. Without time to adapt to new proteins and fiber levels, their gastrointestinal tract rebels. This leads directly to acute diarrhea, vomiting, and often a lasting aversion to the new food you just bought. To do this safely, we need to follow 3 exact steps: recalculating precise portions to prevent weight gain, checking ingredients for toxic human additives, and executing a strict 10-day transition schedule. By mathematically pacing the introduction of the new food, you give your dog's gut microbiome time to adjust. This structured transition provides the nutritional benefits of the new diet without subjecting the dog to immediate physical suffering. Step 1 happens before you ever mix the food. Look at the feeding guidelines on your new packaging to calculate the correct portion size. This image shows a standard measuring cup of dry kibble next to a cup of dense, fresh dog food. The physical volume might look identical, but the caloric density varies between brands and food types. If you just eyeball the portions and assume 1 cup of the old kibble equals 1 cup of the new fresh food, you will likely end up severely overfeeding your dog. This chart highlights the scale of the current pet obesity crisis. According to a 2022 report, 59% of dogs in the U.S. are now classified as overweight or obese. You will also need to adjust these baseline caloric calculations if you have a puppy or a pregnant dog, as their energy needs fluctuate significantly compared to a standard adult dog. If you skip the calculator and guess the portion size, an expensive diet upgrade becomes a direct path to chronic weight issues. Step 2 deals with picky eaters. When dogs hesitate to eat unfamiliar food, owners often try to coax them by mixing in human leftovers, commonly called toppers. But grabbing random items from your fridge or pantry introduces a massive risk. Many common kitchen staples are highly toxic to dogs. This checklist covers the most dangerous offenders. First is xylitol, an artificial sweetener often hidden in peanut butter. Ingesting it triggers rapid hypoglycemia and acute liver failure. Next, adding any amount of garlic or onion powder to their bowl actively damages your dog's red blood cells, compromising their ability to carry oxygen through the body. Seemingly harmless fruits like grapes and raisins are equally dangerous, as even small amounts can induce sudden, irreversible kidney failure. Finally, tossing in fatty scraps like bacon or fried chicken can severely upset their stomach and trigger pancreatitis, a painful inflammation of the pancreas. If you absolutely must use a dog-safe topper to encourage eating, introduce it as a tiny intermittent treat during the first week, so you can easily monitor them for any food intolerances. Improvising with unchecked human food to smooth over a picky eating phase transforms a simple diet transition into a fatal medical emergency. Now that we have the right portions and 0 toxic additives, step 3 is executing the 10-day transition schedule. This chart breaks down the exact daily ratios. For days 1 through 3, you'll fill the bowl with exactly 75% of their old food and mix in just 25% of the new food. On days 4 through 6, you advance to a strict 50-50 split of the old diet and the new diet. Use this halfway mark as a checkpoint. Monitor their energy levels and stool quality. If you notice any loose stool or discomfort, pause the progression and hold at 50-50 until their system settles. As their gut successfully adapts, move to days 7 through 9. Now, push the ratio to 25% old food and 75% new food. Finally, on day 10, the bowl becomes 100% of the new food. Following this specific mathematical progression is mandatory. It gives the gut microbiome the exact timeline it needs to process unfamiliar protein and fiber profiles safely. Even with careful planning, you need to watch for warning signs of a failed transition or accidental toxic ingestion. If you see a sharply hunched posture like this, it is a primary indicator of severe abdominal pain. If you suspect toxicity or see intense distress, do not try to treat the dog yourself. Contact your veterinarian or call the ASPCA Poison Control Center immediately at 888-426-4435. Keep in mind, every dog is different. If your pet has an exceptionally sensitive stomach, you can stretch this exact same ratio progression across a 14 or even 21-day timeline. By combining strict portion measurement, a zero-tolerance policy for toxic human toppers, and this measured 10-day progression, you ensure your dog safely receives the full nutritional benefits of their new diet, completely free from the trauma of digestive illness.